there, Becky Andrews here with Wilson Post in Motion, and this week we are at the Lett Center once again, but this time we are with Christy Lett, and Christy is a licensed esthetician and certified laser technician at the Lett Center. So tell us what we're going to do today.
Okay, Julia has an area right here. So this is an area of concern for her, and so we want to target that today. We're going to do so by using our V-Beam Perfecta, which is a vascular laser. So this is the device that we're going to use today on that. So when you treat telangiectasia like this, a lot of times it's one of the most frustrating things for patients because of the ugliness and that draws attention to it. However, it's a treatment that requires time. It's not an immediate result. You will see clearance upon treating it, but it usually takes anywhere from 6 to 12 weeks for your body to reabsorb the treated vessel. So ideally this is something you want to do in the winter or in the fall where you know that you're not going to have shorts on or skirts or something like that where it may draw attention to you, because sometimes it can look worse post-treatment.
Okay, so have you had any treatments before today, Julia?
We've worked on it some, and it looks incredible.
That's what you were telling me earlier. So what kind of, how many treatments do you have to do to get rid of a space like this?
Well, obviously this is a larger area, so this is something that has required multiple treatments. Typically when you're treating any kind of leg vein, I usually tell patients you want to expect between 1 and 3 treatments. I usually space those treatments about 6 weeks apart because everybody's body is a little different and it will take a different amount of time to reabsorb that vessel. So typically the further they are from your heart, the longer it's going to take your body to heal, because your body's so resilient it wants it to come right back.
Right.
So
and essentially you're breaking these broken vessels down, and they're being absorbed back into the system.
Right. Basically what we're doing is we're heating the blood up in that vessel, and by doing so we're going to blanch it off and basically push it back out into the system. So obviously these are vessels that your body's going to want to try to reroute that blood somewhere else. So what I tell patients is typically you want to make sure that you don't let it get to this place again, because your body's going to try to route that blood and form vessels around there adjacently. It may just take a lot longer because this is 40 something years of that, but genetic predisposition has a lot to do with it. So typically I tell patients, do what you want to do now to a point where you're comfortable, and then think about coming back in a couple of years for a touch-up.
Okay, because it might come back.
Well, or vessels adjacent to it, not that particular vessel, because your body's so resilient it wants to reroute that blood.
Right, okay. And what causes this?
Genetics has a lot to do with it. Lifestyle, your job, depending on if you work on your feet a lot. If you're already predisposed to that, it just exacerbates it. Pregnancy a lot of times worsens it for patients as well.
Right.
But generally speaking, working on your feet is one of the worst things for you.
And concrete.
Correct.
Right.
And because a lot of people don't want to wear compression, which is important to prevent these worsening. So I always tell patients immediately post-treatment you need to avoid exercise, and you do need to wear compression a minimum of a week post-treatment.
Okay.
And of course during the summertime people don't want to do that because it's
hot.
It's hot. So that's why again the winter is an ideal time to do it.
Right, right. Well, I'm sorry you're here in July doing it. Thank you so much. You're a trooper. Okay, so you're going to get started, and
I am.
This particular procedure is called what again?
It's we're using the V-Beam Perfecta for treating spider veins.
Okay.
So this particular treatment, usually we allow 30 minutes to do so, and it typically retails for $200.
Okay, so about $200 per treatment.
Correct.
And how long does it take to
I
do
usually
it?
just allow 30 minutes, just simply because most patients are kind of tapped out.
Because it's not the most comfortable thing,
Correct.
I'm sure.
It is a little discomfort, and of course I book out an hour appointment just to allow for if they don't wear shorts or a skirt or something like that, so they can dress and redress.
Okay.
And then if they bring their compression, that they can put that on immediately post-treatment.
All right. So we're going to go ahead and get started. Okay, now we're getting ready to start, so we all have to put these on, these glasses to protect our eyes, and Julia is going to also put her protective wear on. Christy's got hers on, and you are going to get started on this.
So basically I'm just zeroing in on the vessel, and you can see that this linear piece of light is focusing the light where the vessel is, so we don't have a lot of collateral damage that can happen. You okay? So basically the nice thing about the V-Beam Perfecta is that you can double pulse on a particular vessel.
Okay, so Julia, tell me what, does that hurt?
It stings just a little.
Okay.
but it's tolerable.
Okay.
And then she presses on it after it's done. It relieves it,
Oh, okay.
so
It's bearable. Very bearable.
I think one of the best ways that I know how to describe it kind of feels like a sweat bee. You know, it's kind of annoying because you start to feel like you're just hitting the same vessel again and again. So I try to bounce around so that it's not too uncomfortable for the patient.
Well, I know some people may think that this is just primarily a procedure that a female would have done, but our photographer David mentioned, men may want to come in and do this too. Do you have a lot of men come in for any kind of laser treatment?
I do. I don't have as many men for this particular procedure, but I have done a couple.
Okay.
Typically men come in more for hair reduction,
Yes.
or I can use the same laser for rosacea and
Okay.
facial telangiectasia.
What is facial telangiectasia?
That is broken capillaries on the face.
Okay.
So a lot of times people that have a ruddy complexion that, they look like they have a lot of years of sun exposure, or, they flush easily, and their face typically is red when they, get really hot or really cold. So they'll come in and we can reduce that redness significantly.
Okay.
So a lot of times, because men don't have the freedom to wear cosmetics, to camouflage that, so they come in much more frequently for that.
Okay. And you said this started out much bigger, this area.
It did.
Okay.
It was much darker and much more pervasive. You see how there's the blue cast for the larger vessels?
Yes.
Okay. A lot of this whole area was like that. We've kind of condensed it to this, but it was further out through here.
So the smaller red one, is that where you're zapping now? Is that
I
what
am.
Okay.
I'm focusing in on those. The other thing that I can do is go through and laser all of the background, but I do know that the blue ones, of course, are larger and they're a little more uncomfortable. So I'm trying to ease her way into this.
Okay. Okay, it looks like we're done. I think Julia's had enough now.
I think so.
She's tapping out. Well, thank you so much, Christy and Julia. It looks great. I mean, I can already tell a big difference in it. I can tell some of the little vessels have gone away, so she'll come back in about 6 weeks, have another treatment, and then you'll see from there.
Yeah. Basically, we'll see how much of this is reabsorbed, and whatever's left we need to retreat. That wouldn't be uncommon. And between now and then, hopefully she'll just see more and more improvement.
Oh, great. So this time next summer, I mean, it looks great now. So next summer, this little piece could be gone. Well, thank you so much, Julia. Christy, again, thank you. And you were very brave. I don't know that I could have done it. And thank you for joining us again this week for Wilson Post in Motion. Check us out next week. We will have another fascinating story to tell you. Until then, goodbye.